everyone, to another podcast put out by the Standards and Training Committee of the National Council on Interpreting in Healthcare. And I am really excited to have a very special guest here with us today. Somebody has a great project that I want to hear all the details. And her name is Melissa Anderson. She's a PhD and MSCI, a psychologist and clinical researcher, and associate professor of psychiatry. She's also the co-director of DeafYES, Center for Deaf Empowerment and Recovery, deputy director of Implementation Science and Practice Advances Research Center, which has the best acronym, I-SPARC, at UMass Chan Medical School. Melissa is a Gallaudet University trained psychologist and clinical researcher who strives to provide accessible behavioral health care to members of the U.S. deaf community. She is an associate professor of psychiatry and population and quantitative health sciences at UMass Chan Medical School. She founded the DeafYES Center for Deaf Empowerment and Recovery at UMass Chan, where she has continually provided outpatient therapy and conducted research on deaf mental health since 2011. But what I'm really excited about is to hear about this educational film that DeafYES has put together called Vital Signs: Healthcare Access for Deaf, DeafBlind, and Hard of Hearing Patients. And welcome. I want to hear all about this project because there isn't enough educational training there for providers and people who deal with folks who either don't speak English or who are deaf, hard of hearing, or deaf-blind. So really happy you were able to join us today, Melissa.
Yes, thank you so much for having me. I'm thrilled to come represent the team and talk about the Vital Signs film. I do just want to recognize from the outset that this was a labor of love created by hundreds and hundreds of people, deaf co-investigators, deaf community advisors, our film director, actors, extras, consultants. So, it really was a community effort to create this project, and I'm really honored to be here representing the team. So the Vital Signs film came about from a 3-year grant from the National Institute on Deafness and Other Communication Disorders. And it's interesting because at the beginning of the project, we planned to create kind of like 2 small training films. One that was focused on teaching hearing researchers how to do a better job of conducting informed consent with the deaf community. And then a second small film focused on hearing healthcare providers, teaching them how to do a better job conducting the informed consent process with deaf patients in the healthcare system. And so we started off in our first year of the project conducting focus groups, 8 different focus groups. Some of these were with healthcare providers themselves, some were with researchers, and then we had several with members of the deaf community. And what came out of, stage 1 of the research was the deaf community participants really saying very clearly that, yes, we believe that the informed consent process is important. And yes, we believe that hearing researchers should be taught about how to better work with deaf people. But right now we have a crisis on our hands when it comes to just basic healthcare access. Mm-hmm. So what we were hearing from our deaf focus group members, our deaf community advisors on our team was basically that our area of focus was a little bit off. And so what they were asking of us was to, instead of splitting our time and energy between these 2 smaller films, to really focus all of our energy on creating a film to teach hearing healthcare providers how to do a better job providing access for a range of deaf people. So not just a deaf person who uses American Sign Language, but also deaf-blind individuals, hard of hearing individuals who might rely on spoken English. They wanted us to include case examples of individuals for whom American Sign Language was their second sign language, not their primary sign language, that they actually had a primary language foundation and a sign language from another country. And we were really fortunate that when we took this information back to the National Institute on Deafness and Other Communication Disorders, that they said, yes, by all means, follow the community's like strong suggestions and go in this direction. So I feel, looking back, I feel really blessed that we had that support to do a change of scope and reframe our initial plan. Because what we were hearing from the community is that while those things were important, it wasn't what was most critical and needed for the community right now. And so we were able to make that shift. And what I believe and hope is create a training film that really aligns with what's most needed right now in the deaf community.
Well, that's so exciting. How long did it take from those, not from those initial meetings, from when you got the green light to change the scope? How long till you actually debuted
The
your
film.
product? Yes.
I would say the whole process of script writing, recruiting actors, filmmaking, editing was between 1.5 to 2 years in and of itself. It was a huge undertaking. And part of that is because the film includes 4 different clinical scenarios. So we have, our deaf-blind patient presenting in the emergency room. We have a deaf senior citizen female coming to her primary care provider with her deaf-blind husband in tow. We have a hard of hearing young man in a telehealth therapy appointment. We have a deaf woman from Brazil who uses Libras as her primary language, not American Sign Language. And unfortunately, that didn't get communicated. And so the wrong type of interpreter is there for her GI appointment. So, this wasn't just sort of a straightforward film where you have a narrator talking at you for 30 minutes. There is narration in there, but it's interspersed with these 4 clinical scenarios where the viewer can see really the common missteps that providers make, and then how to correct for them and how to do it well. So it was a pretty complex filmmaking process all the way through script writing, through filmmaking and editing. And we were really fortunate to have several people involved as consultants throughout the process. So we had medical doctors consult on the script, interpreters consult on the script, deaf community members consult on the script to make sure that everything was accurate and appropriate. And then they were also there on set, making sure that we did things like, that the screen that showed heart rate and blood pressure was accurate for like someone who thought they were experiencing a heart attack. So we really had so many hands on deck making sure that the end product was as accurate as humanly possible.
I mean, you made 4 little movies, which meant coordinating like 4 separate crews, 4 separate sites. I can't even begin to imagine. We just got done with a 2-day event for trainers and spent like the last 6 months coordinating that to get everybody to show up at the
Mm-hmm.
right time, in the right place, have connectivity, uh,
Yep.
be heard by those who were participating. I cannot imagine what goes into getting together this educational, is it a film or is it an educational video?
I would call it an
Available on
educational film
YouTube.
or video. Yeah, I sort of use those interchangeably. Yeah, I mean, so the director and the filmmaker that our team worked with, director Stephanie Clark and filmmaker Brian Horch, were incredible at coordinating these really complicated shoots. And, for example, the emergency room scene and the pre-colonoscopy scene, we filmed those the same day. One was in the morning and one was in the afternoon and early evening. And so we had more than 50 people on set that day. Just coordinating the lunch order was complicated. That was my job. But, actually coordinating the movement of people, making sure everyone was prepared, they just did an incredible job. And even now, the three of us joke about it and we look back and we say, like, did we actually pull that off? How did we actually pull that off? Sort of incredible. And I think that shows just like how much everyone was invested in making this happen. Everyone showed up, like mostly on time, and everyone really took seriously what they needed to do, whether it was having a major role in the film or being an extra in the background. Everyone was just really committed to making this product happen.
So how are you getting it out there beyond, making it available on viewable sites? Because I've seen postings of different events, of showings in different cities. So please tell us more and when they're coming up and where we can get more information.
Yes. So we had our first event on January 11th of 2024. And that event was an online film release, really intended for anyone, but mostly intended for the deaf community themselves. We wanted to showcase it first to the people that asked us to create this and that were so involved in the process. So this was a way to thank them and to make sure that they were kind of the first to know. Um, and it was our first, for DeafYES, it was our first online event of this size. And we're really proud to say that we had 264 people attend. And immediately after the event, we had the film go public on YouTube. And in the past 2 weeks, so it's been released for about 2 weeks, we've already had 3,600 views of the film.
That's awesome.
It's pretty exciting. And the film premiere was attended by people from 9 different countries across the globe, I think like 19 different US states. So we really saw so much more representation that we ever could have dreamed of. It's been really exciting. And so for the past couple of weeks, those 3,600 views are basically just word of mouth of people who attended the premiere or who have seen it advertised on Facebook saying, hey guys, look at this. This is great. Let's share it. We hope to host additional film events in person in the coming year. We applied for the NIH Build Up Trust competition, which is it's a prize for research teams that use innovative methods to build trust between research communities and communities themselves. And so we're really hoping that we're chosen as one of the awardees, because what we proposed is to, in different locations, partner a deaf community agency with an academic medical center to co-host a film event, with the hopes that not only will they, invite people from both the medical community, the local medical communities, and the local deaf communities, but it will establish a new partnership between that agency and that healthcare system. So we're really hopeful that those that will receive that award. And then we're going to be hosting an event in Maine, one in the Providence, Rhode Island area, one in the Boston area, and one in central to western Massachusetts. So that's sort of the immediate goal. A more long-term goal is that we want to apply for another grant to continue researching vital signs. And we really want to look at how the vital signs film can be integrated into medical school curricula most effectively. So as a film itself, it's a 30-minute film. How much behavior change among providers can a 30-minute film really make? What other components are necessary, like medical simulation with deaf patient actors, debriefing sessions with members of the deaf community, et cetera. So in terms of next steps, I think that's where myself and my team would like to go, really focusing on implementation and how to most effectively implement this new tool in medical school education.
That's really critical. And there's very few medical schools doing what I think needs to be done in order to have interns and residents hit the ground running. And I know that University of Washington out here in the Pacific Northwest does do a day where they pair residents with volunteer fake patients pretending to not speak English with a certified interpreter and have them conduct their exam, their first visit, quote unquote, with that pretend patient to get a feel of what it's like to partner with an interpreter. And I know that University of Vermont and University of Rochester in New York also have a day where they do the same thing, but instead with ASL interpreters rather than spoken language interpreters. But that's the only 3 universities that I've heard of, which doesn't mean there aren't other schools doing this, but this is a particular area of interest of mine. And so I try to keep my ear to the ground, and I just haven't heard of anyone else doing it. And I think partly it's because they don't know how to get started. They might not have deaf interpreters. But you having this film is a great foot in the door, because you could say, why can't we have a continuing education module? We'll show the film, we'll invite, even if we don't have a staff interpreter, we'll get somebody from one of the agencies that we contract to come in and do some kind of demo or practicum with our allied healthcare staff, as well as medical students. It shouldn't just be the doctors. Nurses need to know how to partner with interpreters as well. So what could we do as a national organization? Can we post the film somewhere in our reliable resources area, or what can we do to help spread this word?
Yeah. I mean, post it wherever you would like. So really, one of our primary goals of all the products we create at DeafYES, whether it's a training tool or tools for therapy or American Sign Language translations of like mental health screening measures, really everything we do, our goal is to create open access products and to have them on our website, on YouTube, and we want people to share them because the deaf population has been so terribly underserved and underrepresented in research in the healthcare system that we just want to remove as many barriers as possible. And we have this great gift of being supported by NIH to do various products. So we want to use that to then give back to the community and just make our products accessible. So yes, please share it wherever you'd like, and we're happy to help with that. What I do want to say about, what you were mentioning about standardized patients or patient actors is that after we finished the first draft of the film, the first good draft of the film, we ran a small clinical trial to test if providers and med students who saw the film versus those who just read standard written guidance on how to work with deaf people, if they had differences in how they actually then interacted with a deaf patient actor. So we used medical simulation as our outcome measure. We're still getting into the weeds of data analysis, so I unfortunately don't have anything to share there. But to do that process, we trained one deaf patient actor. So this person is a deaf person who is also a professional actor, and we trained them to embody one patient persona. And then we also had two interpreters who live interpreted during the interactions, but were also embodying characters. So we had one version of the character that was the provider had requested interpreting services in advance, and it was supposed to function more like an in-person interpreting encounter versus the provider who showed up in Zoom and hadn't requested an interpreter in advance and said, I want on-demand video remote interpreting now. And that functioned more like a VRI encounter. So we do have, these skilled individuals and personas that we've created. And one additional goal is to build out our materials around that to create like a standardized patient curriculum. And we actually had the opportunity, we were really lucky to work with Bryant University in Rhode Island. They asked us to virtually train a cohort of their physician assistant students using our medical simulation approach. And what we ended up doing to sort of squeeze into their already chock full curriculum was that we took one of the simulations they already had. It was like a dermatology simulation where the patient presents with a rash. And we just made it a deaf person who presents with a rash, So yes, it was still the dermatology case, but now it had this added layer of working with a deaf patient who requests services with an ASL interpreter. So I think that's also one strategy, thinking about medical education and how hard it is to carve out space in the curriculum is thinking about where there are places that are relatively easy to add this component in simulations.
That's really interesting because I remember I've been working in language access, and my first job as an interpreter at a hospital was in 1980. So I've been doing this forever. And back in the day, we all felt like lone wolves. Nobody else is doing this. This is the only hospital that has interpreters on staff. This is the only, before there were standards of practice, et cetera. The coming together of leaders from various points geographically in the US to create the National Council on Interpreting in Healthcare 25 years ago I really wish I could have been a fly on the wall in terms of all of these lone wolves coming together and feeling, oh, wow, not only am I not alone, but many of the conclusions that I have come to are shared by all these other people fighting the same battles. And I feel that we're at in terms of language access and using interpreters or working with interpreters, we're at another point like that, rather than interpreter trainers and managers of programs realizing, hey, I'm not all by myself. There's other places that do this. Now it's different areas of language access. Interpreting needed in schools, interpreting needed, of course, in the courts and healthcare, interpreting needed in social services, interpreting that's ASL, interpreting that's spoken language, interpreting that's tactile. Like all of us are converging. And I think there is another moment of significance that's happening all around us with some support from the changes that have happened to federal law. I know spoken language interpreters have always been jealous that the ADA has more tooth to it. It has financial penalty for not upholding the law, whereas Title VI has a beautiful aim, but no enforcement or limited enforcement power because it's not linked to monetary damages. I mean, look how much people respect HIPAA because they know they're going to get hit with a $50,000 fee for their very first offense. So the fact that language access is growing in fits and starts in so many different parts of our lives really, I think, gives us the opportunity to have each other's backs, to close the gaps in the fence so that we can all advocate for similar things, which is reducing health disparities, improving health outcomes,
Mm-hmm.
having people understand what's happening to them so that they can comply with
Mm-hmm.
taking their meds, getting their referrals, following their physical therapy, all of the things that people complain, oh, this is a non-compliant patient. Well, did you call interpreter services? Do we know that this person knows how to get their refill, how to
Mm-hmm.
get their medication correctly? And that just falls down the steps. It's like water coming down a mountain. You see all those collateral situations, parents not understanding why their kid's getting in trouble, why their kid is being held back a year in school because no interpreter called to that parent teacher meeting.
Mm.
We really have a chance, I think, to link arms now and make the changes that we've been so hungry for so long.
Yeah.
To
And
the
and I
table now. Yes.
mm-hmm. And I think it's a good point because most, if not all, medical school curricula do reserve space for language interpreting or for working with patients with disabilities. They don't in those modules always recognize the deaf community or the community of deaf people who use sign language. So I think, that's one opportunity for where to get in and then build out that space. Um, I will say, both of my co-investigators on the Vital Signs Project, Alex Wilkins from UMass and Tim Riker from Brown University, and I can see your pennant there. So, um,
Yeah.
from, yeah, from Brown, they both have developed and led optional enrichment electives for medical students focused on deaf health. And the feedback that they get most often is that, the students say, if I hadn't done this optional elective, I wouldn't have received any exposure to working with deaf patients before I left medical school. And so I think, like you said, like what's next? I want to go from this place of it being something optional that students elect into, which is great, but something that all students receive exposure to, and not just 10 minutes as part of another module on
Right.
diversity.
I want to see this movie at the medical conventions. I want to see National Council present at whatever the conventions are that doctors, nurses, medical assistants, anyone with direct patient, hands-on patient care goes to. We need to be there too, not just to our little regional interpreter associations, but this is the time, I think, for us to really just close off the gaps by coming together in all the professions that touch the patient's life.
Mm-hmm.
So, yeah, I stand at the ready, and I know if I go back to the board and say, hey, let's post this movie, like everyone was so excited about it, I
Oh.
I can predict that it would be unanimous approval. But like, what more can we do? Let's share what we come across as we come across it and just try to prop each other up because that rising tide, it lifts everybody, not just
Mm-hmm. Mm-hmm. Yeah, that sounds wonderful. Thank you. Thank you.
anything else you want to share with us, Melissa? Because I'm really excited to go spread the word about this and get the word out to our membership. So, like the old commercial said, and then you tell two friends, and then they tell two friends, and then they'll tell two friends.
No, I mean, I think the main things are just gratitude for the enthusiasm that we've seen about the film so far. When you release a new product or project, it's always a little nerve-wracking because, what might the flood of constructive criticism be? And, we've received a couple of kind of minor pieces of feedback, but overwhelmingly like positive excitement for this film and desire to share it. So that I think is a reflection of the community engagement throughout the process, that we created exactly what people were asking for. So that's just been so wonderful to see, and just has made us all very proud.
And getting feedback and collaboration like you did from Bryant, is it University?
Mm-hmm.
And taking that idea and maybe contacting more programs saying, hey, Bryant did this with us. Would you be interested in doing something similar with us? And just trying to plant that seed in as many training programs as possible. I mean, I used to notice the difference when I would train residents that had chosen family medicine. It was like preaching to the choir. They totally understood, whether they were pediatricians or adult medicine, the need to have an interpreter present the very first time to get off on the right foot. Some of the specializations, not so much, like, oh, I don't need an interpreter for this or that. But if it was a transplant, okay, then I'd get an interpreter. It was like, well, why not an interpreter every time?
Mm-hmm. Mm-hmm. Yeah, I mean, so the big dream is that I would love, once we sort of operationalize our standardized patient process and our simulation, I would love to recruit and train more deaf patient actors, more interpreters slash actors, and have the capacity to run like a virtual simulation, medical simulation center, that any university across the country that we could provide virtual simulations for. Because I think, like you said before, it is a challenge. I think a lot of schools would do this and would be enthusiastic about it, but don't know where to start.
Right.
They don't
And they don't
know.
want to make the movie, but they're happy to take the well-made one if you have it, right?
Yes.
Too much
But
work
even in
to produce
terms
the
of
product.
simulation, who do I even reach out to begin to recruit a deaf patient actor? How do we train that person? How do we prepare the interpreter, et cetera? So I would like to build that out more and create a resource that we could offer more widely across the US.
That's great. Well, we'll talk offline because the Pacific Northwest, especially the Seattle area, has a very high percentage of deaf-blind residents. And it's also, I guess, since, I don't know, for at least 20, 30 years, been a secondary site, since Northern Exposure and then some of the movies about vampires and werewolves. Has been a site where there are a lot of movie shoots, pretending to be Canada, pretending
Mm.
we have a lot of different, we've got beach, we've got mountains, we've got forests, we've got desert, we've got farms. So there is a confluence of both the movie world and that subset of folks that you're looking for, that there may be a higher percentage of deaf or deaf-blind actors here in this area. I don't know. But
Yeah,
friends in the community, let's talk and see if we can't get something going at this corner of the country. So
sounds
I'm
great.
going to say thank you so much for joining us today and sharing this exciting project and giving us the opportunity to help sow some seeds of awareness and sow some seeds of education and maybe grow this a little bit further so that the roots get spread out further and further amongst all the 50 states. Thanks again for joining us today, Melissa Anderson. Thank you so much for making this movie. And we'll see you again soon, membership and folks listening to our podcast on YouTube. Thanks for joining us.